Vaccinations, or immunizations, have been one of the greatest medical and public health achievements of all time. They have saved millions of lives and have spared millions of other people from the devastation of infectious diseases. In the last 50 years, smallpox has been eliminated, polio is on the verge of elimination, and many other dreaded diseases are at an all-time low. And as successful as these efforts have been, new vaccines are becoming available each year so that the potential impact of vaccines will continue to grow. How has this been accomplished, and how can we do even more to make the world a safer and healthier place? Stay tuned and you'll find out on today's episode of A Public Health Journal.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to talk about childhood immunization, an activity that has saved more lives and improved the quality of our lives more than any other medical intervention over the last 50 years. We'll be looking at some of the reasons why immunizations have been so successful, and we'll be looking at some of the challenges that we face today in using vaccines to make the world a safer and healthier place. Joining us in our discussion today is Dr. Melinda Wharton, the Acting Director of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention, or CDC, in Atlanta, Georgia. Dr. Wharton has worked extensively on issues related to vaccine policy, vaccine safety science, and public health response since joining CDC's immunization program in 1992. Dr. Wharton, welcome to our program.
Thank you. I'm delighted to be here.
And I'm glad you're in Minnesota. What brings you to Minnesota to talk about immunizations?
Well, I'm here as part of, to help support Minnesota's celebration of National Infant Immunization Week, which is a week that we celebrate not only in the United States, but actually now around the world to help raise awareness about childhood immunization and celebrate our success in protecting children from vaccine-preventable diseases. So I'm really happy that I got a chance to come.
Yeah, well, immunizations are just a part of life, so does it take a lot of work to get people to start thinking about vaccines?
Well, you know, I think it's kind of easy to take it for granted because many of the diseases that vaccines prevent, because the vaccines have worked so well and we've got such good coverage now, they're not so visible to people. Mm-hmm. And so parents of young children now, you know, this really may not be at the top of their mind when they think about what they need to do to keep their child healthy. So it really does mean that every parent of every new baby kind of has to start over learning about all the things they need to do to keep their child healthy, and immunization is an important part of that.
Okay, so we can't assume that every parent knows that immunizations are really important. And we have 70,000 babies born in this state every year, so that means 70,000 families mm-hmm. have to start all over again.
No, it's and even if you had a baby, 5 years ago and you're having one now, things may be different. There's going to be new vaccines in that schedule. So it really is something that we all have to work on together. The physicians and healthcare providers who take care of pregnant women and take care of young children and take care of families work really hard to help the people in their practices understand the importance of immunization, get those vaccines delivered on time, answer people's questions. But people get information from all kinds of places now, so there's really a much broader effort to help make sure people have the information they need to make good decisions about vaccination to protect the health of their children.
Yeah. I know I've been a physician for 41 years, so I've been, back when I started, we didn't have the number of vaccines that we have today, and it was much simpler. It really was much simpler. Now, with a whole host of new things, it's become much more complex. And I know we have a slide here that I know we try to keep it simple, and we have a slide here that shows the immunization schedule. So maybe you could just tell us, how does this simplify things, and what is this trying to tell us, and how can parents and how can healthcare providers use this kind of schedule?
Well, this schedule summarizes our recommendations for all the vaccines we recommend to be given routinely to young children. And in this summary way, we've got sort of a snapshot of all these things that need to be done. When you first started medical practice, there weren't so many vaccines and there wasn't so much to keep straight. Now there's a lot of them, and it's important to give them on time because that provides children the protection at the earliest possible point to prevent these diseases.
And it looks like it starts right at birth with hepatitis B, and then, you know, early on, you know, 2,
Right.
4, 6 months, all the way up to, you know, middle school and high school for adolescents.
Yeah, there's times that there are particular ages where we recommend that the vaccines be given. As you said, the first vaccine we recommend to the baby is at birth. We recommend that the hepatitis B vaccine be given. And then beginning at 2 months of age, then there's a series of vaccine visits that correspond to the well-child visits that are part of, you know, sort of standard, good, well-child visits that we recommend that children have.
So we've actually tried to pull together the medical care piece and the immunization so that it's simpler for families to bring in the kids, because they get several things done at the same time.
Absolutely, and this really is a very important part of well-child care. So, you know, this is very much on the minds of pediatricians and family physicians and nurse practitioners who provide care for young children, to have those visits at those ages and get those recommended vaccines given.
As it becomes more complex and there are more vaccines, do you get some pushback from families that, oh, you know, this is too much?
Yeah.
Can we spread them out? Can we do it a little differently? Can we give just some now and some later? Do you get that kind of pushback?
Well, there are parents who have those concerns, and you know, as I remember when my children were little, and the idea of giving you know, multiple shots to a very small baby, that seems like a lot. It seems like it might, you know, I can understand that parents might feel like that's too much, but what it is an opportunity to prevent all these different diseases, which, you know, used to be present in our community and cause illness and death in children. So it's not too many. It's an opportunity to prevent diseases that otherwise are really a threat to children. And for parents who feel like, well, I just can't quite, you know, that seems like too many, can't we spread them out? If we spread them out, we leave children at risk for a period of time where they didn't have to be at risk. And as a parent, I would feel so bad if, you know, my child ended up getting a disease that I had delayed the vaccine for. So we really want parents to have their child get the vaccines at the age that they're recommended, because that means their child's protected at the earliest possible age.
And this is really scientifically based. When we've done studies to
Right.
show that this is the best time to give it, and that if you really postpone it, you run the risk, as you said, of diseases occurring.
Yeah, we recommend the vaccines at the age we do, because that's how the studies were done of the vaccine. They were licensed based on, you know, giving them at certain ages. But also, the vaccines work best at certain ages. You know, sometimes if you give it at a different time, it won't work so well. But the big thing is we want to give protection to the child at the earliest possible age to protect them from getting vaccine-preventable diseases as best we can.
All right, I want to get into a specific example of what the importance of vaccine, but first we need to take a little break. We'll be back right after this message.
All around town, from stores to playgrounds, babies are on the move. And there are diseases that are on the move too. And some of these spread easily. To best protect him from 14 serious diseases by the time he turns 2 years old, vaccinate him according to the recommended schedule, so he can go on about his business and you can have peace of mind. For more reasons to vaccinate, talk to your child's doctor or go to cdc.gov/vaccines.
Welcome back. We're talking about childhood immunizations with Dr. Melinda Wharton from the Centers for Disease Control. She is the director of the immunization program at CDC. Dr. Wharton, I know that the vaccine manufacturers have, you know, understood how parents think and families, and they've put a lot of the vaccines together so that they've actually packaged them in a way so that there's fewer shots that have to be given. Is that true?
Yes, we have a number of combination vaccines that include multiple vaccines in one shot, and that really helps reduce the number of injections, which I think makes things much less stressful for parents when they're having those immunization visits.
And I also understand that the vaccines of previous years had a lot more antigen, or actually the stuff that got people to have an immune response, and that the actual load of antigens going into babies now is less than it was before. Is that true?
That's true. This whole idea about how much the immune system can handle is something that sometimes parents ask about. And in fact, the immune system can handle an awful lot, way more than the vaccines that we give include. But even just thinking about the vaccines we have now compared to the vaccines we used to use, the actual amount of stuff the immune system has to respond to is much less now with the vaccines that we have, because they're specifically designed to only include the parts of the bacteria or virus that really needs to be there to generate that immune response. So
Okay.
you're absolutely right.
So it's just like computers. They're getting smaller and smaller, but more powerful. So vaccines are getting smaller and smaller and more powerful.
That's a good analogy, yeah.
Good. All right. I want to walk through a case here in Minnesota, because I think it sort of highlights the fact that this is not just something that we can start doing and then stop paying attention. And it's about pertussis. And we've got a slide here that looks at reported cases of pertussis, or whooping cough, in the state. And maybe you could just kind of walk through this slide so people can understand what the issues are that we're dealing with.
Sure, I'd be happy to. So we started using a combined vaccine to prevent pertussis back in the 1940s, a standardized formulation of diphtheria, tetanus, toxoids, and what we called whole cell pertussis vaccine, which was the older pertussis vaccine. We started using that, and what we saw nationally as well as here in Minnesota was a very dramatic reduction over the next decade or so in reported cases of pertussis. This pertussis really came under control.
So we got it down to almost zero in the 1960s and 70s.
Yeah,
I mean, still a few cases, but
yeah, it was at very low levels during that period of time. And it seemed like, this was something that was, just for the history books, that we weren't going to be dealing with pertussis anymore. But what has ended up happening is we have had increases in pertussis in recent years, and at least some of that is due to the fact that the vaccines that we use now, the acellular pertussis vaccine, which replaced the older whole cell vaccine, although it's a very effective vaccine, the duration of protection it provides appears to be somewhat less than what the whole cell pertussis vaccine provided.
And they got away from the whole cell because it had a few more reactions, adverse reactions than the new one.
Yes, the older vaccine, we stopped using it because of concerns about the reactions that it provided. It certainly caused a lot of fever. It caused fever in many children, not all, but in many, and local reactions. And because of concerns about its safety profile, we stopped using it, and a purified vaccine, a purified synthetic vaccine was developed, which, again, it's very effective, but the duration of protection seems to be shorter than it was with the older vaccines. So we're seeing pertussis now, not only in the middle school age and high school kids that we used to see back in the whole cell era, but we're seeing it now in some younger children, as well as continued disease in those adolescent age groups.
Mm-hmm. And as the slide shows, starting in 1990, as people aged out of the protection, started to go up, and then we've had this huge spike in Minnesota in the last year. We've had more cases since 1938. What's going on with that? Do you know?
Well, I can't say that we know everything about what's going on. Certainly, when these big outbreaks occur, we do a better job at finding cases than we do when we don't have those big outbreaks. There's some new diagnostic tools. They may make it easier to identify cases of pertussis that are being used now. But probably the biggest thing is this issue about, since we've moved to the acellular pertussis vaccine, that again, the vaccine is very effective, but the protection does wear off after a while, and that's probably a factor in these big increases.
Doesn't it also change then the policies or the procedures that you have and recommendations you have about who should get vaccinated and when they should get vaccinated, so that adults actually have to start paying attention to pertussis?
Right. We've had a vaccine that's available for adults for a number of years, and we do recommend that all adults get a dose of the tetanus and diphtheria and acellular pertussis vaccine. But because the people who really are most at risk from pertussis are very young infants, the ones who are too young to have gotten, 2 or 3 doses of pertussis vaccine yet on their own. They're the ones that really get sick with pertussis, and in order to protect them, we actually have a new recommendation now to vaccinate pregnant women so that they can pass some protective antibody onto their baby that can help protect the baby during those first few months of life.
And should they get vaccinated at every pregnancy?
The recommendation is to get that vaccine at every pregnancy because those high levels of antibodies aren't sustained. So you want each baby to have a chance to get a good level of pertussis antibody when they're born.
And I know, we have a lot of people in childcare, a lot of infants in childcare. So I know how long ago, or probably 10, 15 years ago, we changed from just having your every 10-year tetanus shot to actually having a diphtheria, tetanus, and then adding pertussis to that, the whooping cough to that for adults.
Right. Well, right now our recommendation is to replace one of those TD shots with the TD with acellular pertussis vaccine. I think we will end up with repeated boosters being recommended, but right now it's really just pregnant women that we recommend more than 1 dose for.
Okay, good. Well, I'm going to talk a little bit more about the federal role, the state role, local role, but first we need to take another little break.
Great, thank you.
We'll be back right after this message.
All around town, from grocery stores to playgrounds, babies are on the move. And there are diseases that are on the move too. And some of these diseases, like measles and whooping cough, can spread easily. To best protect him from 14 serious diseases by the time he turns 2 years old, be sure to get him vaccinated according to the recommended schedule. That way, he can go on about his business, and you can have peace of mind. For more reasons to vaccinate, talk to your child's doctor or go to cdc.gov/vaccines.
Welcome back. We're talking about childhood immunizations with Dr. Melinda Wharton from the Centers for Disease Control and Prevention in Atlanta, Georgia. Dr. Wharton, you come from the federal agency and you're sort of our national health department. Tell us a little bit about what you see as the role that CDC plays in immunizations, and particularly as it relates to what goes on in states and local jurisdictions.
Sure. So what we do at CDC is, one of the most important roles we play is we convene the Advisory Committee on Immunization Practices, which is a group of outside experts in public health, in pediatrics, in medicine, in vaccine development, who give us advice about how to use vaccines to best protect people. And that really forms the standard of care that's reflected in the vaccine schedule we talked about earlier. We also monitor the diseases to see, do we need a vaccine to prevent a disease? Are the vaccines we're using working the way we expect? Do we need to change the schedule, change our recommendations to better control disease? Like a few years ago when we added a second dose of MMR vaccine, or more recently when we have this new recommendation to give pregnant women the tetanus and diphtheria and acellular pertussis vaccine. Another thing we do is monitor vaccine safety. And we work with our colleagues at the Food and Drug Administration to monitor adverse event reports, as well as doing studies to look at specific vaccines and specific health outcomes to make sure we understand the safety profile.
All right, and then how about the production of vaccine? Do you monitor that? Do you encourage people to, the private sector, because I assume we don't have any more public production of vaccines like we did for several years. Do you work with the vaccine industry in making sure they get the right vaccines and then distribute them throughout the country? Yeah,
the private sector plays a very important role in vaccine production in the United States, and as you say, almost all of it is located there. I think the Massachusetts Department of Public Health still produces some vaccine, but that's the only public manufacturer I'm aware of at the moment. So it really is almost all in the private sector. They make a big investment in vaccine development, and And they work with us to try to, make sure we've got the right amount of the right vaccines and that we get it to the right places and the right providers so that everybody can protect the children in their practices. This really becomes a big issue when we've had vaccine shortages, which has unfortunately happened many times in recent years. Vaccines are complex products to manufacture. A lot of different things can go wrong in a very long sequence of events with very rigorous quality control. And so if anything is not exactly the way it's supposed to be, that whole batch of vaccine doesn't move forward. So we have had shortages, and that's an area that in particular that we work really closely with the manufacturers to try to limit the impact of those shortages on public health.
When there is a shortage, and I know we've experienced this in our state, trying to make sure you get it to the right spot. Do you have the authority to move vaccines in various places, or is that sort of the marketplace doing that?
Well, it's not so much that we move it around. We try to make sure it gets shipped in the first place to the places where it needs to be. Often what we do when there's a shortage is actually allocate vaccine. And this is where the working with manufacturers is so important, because we can control public sector distribution. The vaccine that we buy, we can send it where we think it needs to be. But on the private sector side, they handle their own distribution and selling and marketing. But they work with us to make sure when there's a shortage that somebody can't buy more vaccine than they really need to provide the critical doses to the patients in their practice, so that the vaccine that we have is shared equitably among all the providers, and if we have had to drop a booster dose, that everybody drops the booster dose. Not some people do, and then other people don't even have enough to give the doses that we still recommend.
And I know you've developed the Vaccine for Children program for the public sector, where some children didn't have insurance, or they had insurance that didn't cover vaccines, and so it was difficult. Do you see that with the Affordable Care Act and the changes that are going on with health reform, making that program a little different, changing somewhat?
Well, I think the Vaccines for Children program is always going to be an important part of providing vaccines for pediatric practice, because VFC not only covers children whose families don't have insurance at all, but children who are on Medicaid. And so that really is the Medicaid part of childhood immunization is covered through the VFC program. What I think the Affordable Care Act is going to do is fill in some of the gaps for people who had insurance that didn't cover vaccines, because there's actually now a requirement that new policies have to include the ACIP recommended vaccines without out-of-pocket costs for the family when they get it from an in-network doctor. So that's going to be really important in filling in some of the remaining gaps that some families had in access to immunization.
And I know that here in Minnesota, the state health department works with CDC, and we help get information out, a lot of education, and we're going to run the Vaccine for Children program and make sure that vaccine gets distributed and do all of the monitoring and collecting the data. And the local health departments work with us. But it all comes down eventually it comes down to the parent. And so what do you counsel parents about in terms of immunizations? What kind of message do you give to them?
Well, what I would like parents to know is that immunization is an important part of protecting their child's health, and if they've got questions, they need to look for a good source of information to get an answer to those questions. We live in an era where there's a lot of information out there, and some of it isn't accurate, or it's misleading or confusing. So find a credible source of information. Something like what the Minnesota Department of Health has on your website, or the American Academy of Pediatrics, or CDC has good information on our website too. So there's a lot of good information out there, and if they've got questions, look for a good, accurate source to get answers to their questions. But parents really want to get their questions answered by their healthcare provider. They want their provider's recommendation, and so they do need to ask their questions of their doctor. And I'd also suggest that they keep their child's immunization record. You know, there's a great registry in Minnesota that can help keep track of immunizations, and for the parent to, you know, be able to keep track of that themselves, I think is an important thing for parents to do too.
Yeah, in the last few seconds, so you've been in the immunizations for a long time, a big part of your medical career.
That's right.
What do you see coming down the road? Are we going to have some new vaccines, some new approaches, some different schedules?
Yeah. You know, one of the things I think that's going to be really exciting is if we can do better with control of influenza. We've got, I think having better influenza vaccines in the future that can be more effective in older people is something that we really need, and I hope we'll have those soon.
Okay, great. Well, thank you for coming to Minnesota. Thank you for being on the show. This was very helpful.
Thank you so much.
And even though we had snow, yeah. But that's the way life is in Minnesota.
It was great, thanks.
Good. All right, and I'll be back with a closing comment right after this message.
As a parent, you work hard to keep your baby healthy by giving lots of love, providing healthy foods, keeping little hands, feet, and faces clean, getting plenty of physical activity, and vaccination. Nothing protects babies better from 14 serious diseases by age 2. That's why doctors recommend and parents choose the safe, proven protection of vaccination. Vaccination, a key piece of the puzzle. For more reasons to vaccinate, talk to your child's doctor or go to cdc.gov/vaccines/parents.
Each day in the United States, over 12,000 children are born. This means that each day, 12,000 more children are added to the pool of people who need to receive the vaccines that will protect them from serious infectious diseases. Just the sheer number of babies born each day makes the routine immunizations a daunting task. But when you add to that the fact that new vaccines are continually added to the list of needed immunizations, you get a challenge of massive proportions. Yet, according to the Centers for Disease Control, over 90% of the nation's 2-year-olds have received their most critical immunizations, a marked improvement from the situation of just a few years ago. This is a truly remarkable achievement, and one that must be sustained if we are going to continue to be a healthy society. The reasons for this success are many, but I would like to highlight just 2. One is that a strong public health infrastructure was critical for the creation and maintenance of a system to develop the right vaccines, assure their safety, and get the vaccines distributed and into people who need them. This public health infrastructure needs to be maintained if this success is going to continue. The second factor in the success of our immunization efforts is the superb collaboration between the private and public sectors of our healthcare system. Without this collaboration, the successful development, distribution, and use of vaccines would not be possible. The immunization program demonstrates the fact that all sectors of our healthcare system are needed, and all must be working together if we are to maintain and improve the health of our world. Health is the responsibility of everyone. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.